Welcome to the MRO Exchange, Connecting Healthcare Executives, your go-to podcast for staying informed in the dynamic healthcare world, where MRO discusses industry trends and topics with prominent healthcare leaders. In each episode, we delve into the intricate landscape of the U.S. healthcare system, shining a light on the immense responsibility shouldered by providers to effectively acquire, manage, and share clinical data with data consumers. Join MRO experts and healthcare executives as they navigate the important dynamics within this highly complex environment. From the surge in healthcare ecosystem demands to the influx of structured and unstructured data scattered across diverse systems, along with the ever-growing compliance, security, and privacy expectations, the MRO Exchange, Connecting Healthcare Executives, unravels it all for you. Tune in for a comprehensive exploration of the pressing issues shaping the healthcare industry today. Hi, everyone. I'm Stephanie Kindlick, Vice President of Marketing at MRO, and I want to thank all of you for joining us on The Exchange, where we are connecting healthcare execs. You can learn more about MRO at our website, mrocorp.com, or continue the conversation with us by connecting with me on LinkedIn. Today, I'm here to connect with two very special guests, Beth Friedman from Fin Partners and Carol Flagg from Health IT Answers on AI in healthcare marketing. Our first guest today, Beth, is a dedicated healthcare champion and PR guru. She started her career as a medical record coder and a clinical data analyst, and has served in a variety of health IT sales, marketing, and PR roles over the years, including at McKesson, eWeb Coding, and her very own firm, Agency 1022, which that's where Beth and I first met. As a senior partner at Fin Partners, Beth is helping to lead the global health IT public relations services for the agency. Beth is co-hosting Fin Voices, where each episode offers a peek behind the curtain of innovation with healthcare's leading changemakers. Joining us also today is Carol, a managing partner of Answers Media Network, where she leads the company's marketing, sales, and social media initiatives. She has over 25 years of experience in traditional and digital media, and she's also the host of What's My Tagline?, a radio show on Healthcare Now Radio that discusses healthcare marketing, specifically the impact of social media, the evolving role of content marketing, and the critical factor of engagement to build brand loyalty. So Beth, Carol, thanks for joining me today.
Absolutely. Thanks for having me.
Yep, thanks for having me too. I can't wait to see how this discussion unfolds.
I want to discuss AI in healthcare marketing for a few reasons, but at first I want to set the stage a bit. So artificial intelligence is a very broad field. It's referring to the use of technologies to build machines and computers that have the ability to mimic cognitive functions associated with human intelligence. That's seeing, comprehension, responding to the spoken and written language, make recommendations, analyze data, and so much more. I did validate that response by you going into Google, and the AI generated response, I validated that it was actually from Google. But moral of the story is that artificial intelligence is a buzzword. It's in almost every industry. It's across everything that we do. It's in my kitchen. I've got my Alexa. I've got AI on my smartphone, my Siri. And while AI can be extremely beneficial, it needs to be used responsibly. Also, back in May of this year at Sway Health, which is a conference specifically geared towards healthcare IT marketing professionals, AI was a very hot topic. And Beth, you and the team at Fin Partners shared the 10 guiding principles for generative AI. And while all 10 are important, there were a couple that stood out: using generative AI as a co-pilot, and then the commit to acting responsibly and ethically with generative AI. And then Carol, you just last week, Health IT Answers, which is again part of the Answers Media Network family, you held a virtual summit on measuring the impact of AI in healthcare. I know there were a lot of topics that were covered, and you're also out in Vegas this week attending an AI conference. So it is all the buzz. So let's get started. Beth, I want to kick things over to you first. Going back to these 10 guiding principles, can you tell us a little bit more about why Fin Partners decided to create these, and what were some of the biggest takeaways?
Yeah, absolutely, Stephanie. It's been a project for the company for about a year now. We have a work group focused on AI, as it was all starting to evolve, especially ChatGPT and generative AI tools like ChatGPT last year. We realized quickly, as a marketing and public relations agency, that it would be a tool in our toolkit. And we wanted to ensure that all employees of the company, anybody that was involved in writing content for our clients, used it responsibly. So to your point, that was probably the biggest driver, was that we wanted to make sure that every single one of our team members was using the tool, whatever the tool may be, because we all know it's going to evolve, is using the tools responsibly. And we created a list of 10 guiding principles, and they've been really helpful in our conversations with clients, in our day-to-day use. The last survey that was done across the Fin employees, I think we're close to 50% of us now are using it in one way or another as a tool to assist us. And that really is one of the biggest pieces in these 10 guiding principles. I'll share with you a few that really resonate with me. One is use generative AI as a co-pilot. So, it's never to be used by itself. The quality is just not there. There always needs to be what they call a UITL, a user in the loop. That's one of the new terms in AI, is UITL. So that user is a Fin employee, where we are putting in prompts, but we are looking at every single piece of output that comes to us, fine-tuning it, refining, rewriting. Nothing ever goes to one of our clients that would come straight from a generative AI product. So that's really the commitment to responsibility and quality that we have internally. One of the other really important principles from the 10 guiding principles is transparency. We want to be transparent. We are transparent all the time with our clients about when we're using it, whether we're just using it to draft some sample social posts for a client to consider. Maybe we're just doing a bit of marketing copy for an email campaign or promotion, or perhaps we're using it, at the start of a full-on article for an industry publication. We always will let our clients know when we're using it. And usually it is in that very first stage of any kind of content creation, just because it really is not good enough for any kind of final product. The other thing I think that's really important that's been honed into us or drilled into us at Fin Partners is privacy, and making sure that we only use these tools for content information that's publicly available. Never ever use any of these tools for anything for your company that is still, behind the scenes, under wraps, not ready for prime time, because you just don't want any of that to get out there. So you do have to be a bit cautious about what you use it for.
I think I mentioned earlier that validating what I had found in my search engine, just around defining like what is Gen AI, just making sure and understanding where the sources are, because there is so much information that's out there that could be feeding that engine, and the response that you're getting. So I think a couple of those are spot on and really important, as a consumer, and understanding how to use these tools responsibly as well.
One of the other things that we're learning as we go, everybody's learning as we go, but especially as it comes to marketing and content creation, is how to really master the prompt, right? How do we ask these tools the right questions so that we get what we're looking for? And there's actually another new AI term called prompt engineering, or prompt engineers. That will probably be a new role you'll see circling around our industries. Prompt engineering just basically is talking about using, being smart as to what you ask it. Ask it for small tasks to start. Ask it for several examples. If I'm writing something, I might say, hey, give me a paragraph on the use of AI in radiology written for the chief of the radiology department. So I'll get very, very specific with my prompt. And I think that's what we're learning as we go. Kind of like how we learned in the Google, right? The long-term searches give you better results. The long tail ones where you've got lots of questions that you're asking. Same thing here. You want to be very, very specific with your prompts. And that's been really helpful.
That's great, Beth. And I see, even thinking about the way that data scientists are asking for, they have an idea in their head and they build some of their programs to validate, and come up with the responses. It can be very scientific in the way that you're asking that question, and asking the prompt. So I think that one is very high up on my list for sure when looking to get information out of some of these generative AI tools. That's great. So, Carol, wanted to switch gears a bit and kick it over to you. You had hosted the virtual AI summit last week, and the focus was actually on a broader aspect of healthcare. Revolutionizing patient care, diagnostics, operational efficiencies through the use of AI. So, can you tell us a little bit about some of those key takeaways during your summit?
Yeah. It's been a busy 2 weeks of AI for me because we had the summit last Wednesday, and now I'm sitting here at the MDM Grand at the AI4 conference here in Las Vegas. So no shortage of AI discussions in my life the last 2 weeks. So it's really interesting. So yes, you're right. We brought together a big cross section of the impact of AI in healthcare, and touching on quite a few aspects of the use of AI technologies. We kicked it off with Chris Ross, who's the CIO of the Mayo Clinic. They have a long history of employing these technologies and talking about the Mayo Clinic's success stories in deployment of these technologies, and perhaps a couple of the cautionary tales as well. But his whole message was, walk before you run, kind of mode. Don't just have a FOMO. And I think a lot of healthcare systems out there and providers and whatnot do have a fear of missing out and in adopting some of these AI technologies. And we closed it, interestingly enough, with a Dr. Chris Gibbons talking about the ethical side of AI, and especially around this conversation around bias that we're all hearing about. So 6 very different sessions, but there were things that were germane to all of them. We talked a lot about security. Every single session touched upon the security aspect, and with the CrowdStrike incident in late July hanging over everybody's imagination, security is obviously a big conversation no matter what area of AI that you're talking about, as you've already discussed and alluded to. And then also this conversation around the fear of AI, right? AI is not sentient yet. We'll see in the future if it will be someday. But that AI is a tool. It is, as you already talked about, the co-pilot. It is about data, and when used correctly in a secure environment, it's not meant to replace clinicians, replace providers, or replace your front end staff. It is a way to streamline the operations of your organization. It's a way to save some money when done correctly, which of course a lot of healthcare providers and health systems are keenly interested in. But at the same time, as the people that are perhaps fearful in the healthcare setting of having their organizations adopt these AI technologies, they, like anything, you have to perhaps up your game, right? You have to understand what the technologies will do, with the idea that hopefully it's going to improve patient outcomes and make better patients for everybody. So I would say that frontline person, especially maybe on the admin side, who is thinking, well, is a chatbot, is that going to replace me? Right? Understand that we're all in an environment, in a digital world and an AI-driven world, that we have to keep up with the game, right? We have to understand it if we're going to responsibly use it and perhaps allow us to increase our tool set, right? As Beth mentioned, prompt engineering is a big thing right now. How do I get a skill set there? How do I, as a clinician, grasp that the use of these AI technologies are going to make me a better physician? It's not going to make me, replace me or make me a worse physician because that AI is going to do better diagnostics, but it's going to help me with my patients. And so I think there are these overarching themes across the AI spectrum that everybody in healthcare is thinking about.
Yeah, that's great, Carol. Thank you. I think about, you see many headlines thinking about clinician burnout, overburdened health systems on the administrative side, and ways that AI and these types of tools can help to take over a piece of the manual, mundane activities and provide the humans that have that analytical lens to work on more complex issues or functions. I think it's just something that a lot of people are leaning into, but of course, cannot talk about new technologies, cannot talk about AI without talking about that lens of security and privacy, as Beth, as you had touched on. And then also, when I think about health IT tools and resources, understanding how are they built, how are the algorithms, what was their data set that they were created on, because we're finding more and more that you need to make sure that you have covered a lot of different populations, for, not including bias, not including discrimination. Your worldview programmed into an AI algorithm may not be fully inclusive, and that might be an unrecognized bias. So there's a lot of things that go into some of the different tools and the uses of AI. So another reason why we're here talking about it is to just make sure general awareness of what some of the pitfalls and advantages could.
This is Beth. Stephanie, I'm glad you brought up the quality of the data. I think that's something really important. So as you're looking to implement or tap into some of these tools, your point is spot on. It's only as good as what you feed it. The old adage, garbage in, garbage out, still applies here. So, we have to be super careful about what we're feeding it and what we're basing things on, that it's valid, that it's high quality data. Those large language models and now small language models, I think that's going to be a huge focus too as we go forward, making sure that the quality is still there. And again, that's one of the reasons for keeping the human in the loop as well. I wanted to share with you too, I saw an amazing list of 10 AI terms. I've actually pulled a few into our conversation today. They were pulled together by Frank Cutita at Chime. And just for the audience listening, it's a great resource to just kind of provide some of the definitions of a few of the terms that we've been throwing out today.
Oh, that's great. Yeah. Well, I haven't seen that yet, so you'll have to share it with me.
Yeah, the title is super funny. It's 10 emerging AI terms that will impress your geekiest health tech colleagues.
That's great.
So frank. That is so frank.
Yes, right? It's a great list. But, he does also talk about the language, the models, and what the tools are using to base things off of. And that needs to be a focus of responsible use of AI.
Well, thanks for sharing that, Beth.
And I would say too, just as a side note, but seems like it's far away, but it's not. I think that language model that you're talking about is going to be a pretty big conversation at Vive and HIMSS in 2025.
Yeah, I agree. Especially as you get into specific clinical diagnoses.
Yep, absolutely.
And clinical applications.
I want to turn over to you both the next question. This will be for both of you, Beth, Carol. How can teams support the organizational-wide efforts in healthcare when it comes to AI and responsible use of AI? Are there any certain recommendations you each have for marketing professionals, or even the patient view, the consumer view of responsible use of AI in day-to-day life?
This is Beth. I can start at the high level. I've been involved in 2 different industry initiatives in healthcare specifically that are focused on the responsible use of AI. One is TRAIN, and I cannot remember what the acronym stands for, but it came out at HIMSS last year. Microsoft is a big player in it, along with 16 leading health systems and they are coming up with the framework for responsible use of AI in healthcare. And the other one is an organization I think has actually been out longer, CHI. That's another one that's really helping to sort of set some of those responsible use guidelines and standards. I think when it comes to staff and teams, I think the most important thing is kind of what Fin Partners has been doing with us is, setting up a steering committee, training us, educating us, encouraging us to use it in small ways. I think, I'm a former healthcare worker, as you know, and so I know what a lot of the mentality is of a lot of the folks that work in our hospitals and health systems nationwide. It's sometimes pretty tech adverse, it's sometimes change adverse, and it's definitely leery of false information because we're dealing with patient lives. So I think the point, Carol, I think that you had mentioned was walk before you run. I think the best thing that organizations can do to be responsible is take baby steps, start with small projects, educate their employees, and make sure their teams and staff are excited about it and ready to use it and not afraid of it.
I think so much of this is reminiscent of what happened when everybody began to take on social media, right? In the sense of incorporating in their organizations, whether you were a provider, a healthcare system, a vendor, back in the day, when social media was like, oh, we're going to have a Facebook page, and oh, we're going to have a Twitter, now X, we're Instagram, all these things. These are kind of the same challenges, right? How do we do this responsibly? What are the HIPAA implications? How are we going to interface our social media strategies with the patient? And so these are very similar conversations. And I think it all really, just like it did back then, which seems like so long ago, but really wasn't, communication, communicating to the team, making sure that everybody's trained appropriately, making sure that everybody down to the top to bottom understands why the organization is doing this and what is the benefit, and that communicate that appropriately across the organization.
Yeah, Carol, workforce empowerment, I think is really big here. I think about just, branding and storytelling in general. You want to, especially when you're with your internal teams, getting ahead of why are we doing this? Why are we making this investment? And really making sure that you stay out ahead of any of the water cooler talk, if you will. Going back to your point about the use of AI kind of having, in some instances, a negative connotation, and just being aware of that, and making sure that you are taking that into consideration with your own internal folks, as well as what you're doing outwardly to to help the processes, and in some cases the patient or your workflows or your things like that. I think it's just incredibly important. Okay, so my last question for today, again, this is going to be for both of you. What do you think is on the horizon for within healthcare and the use of AI? We certainly know it's not going to be a fad. It's not going anywhere. We've seen some tremendous benefits in using some robotic process automation, machine learning, especially here within MRO. So, what are some of your predictions for the future? Carol, if you don't mind, let's start with you this time.
Yeah, I love this. I always love the crystal ball question, right? Because it's sort of like to think back about the conversation and going forward. It's interesting. I when you asked me to come on the show today, which I was very flattered and so appreciate the time, I thought it would be really interesting if I could actually interview, and I probably can, and others have, interview an AI on my show, right? Talk to the AI, about whatever topic I want to talk about. And then I quickly had this thought about, I wonder if that AI could replace me. They could be in the interview seat, and like what that would look like, right? And I'm not the only one having these thoughts. We're all having these thoughts, right? Is to what can AI do for me, right? to take a page from that slogan, right? What can AI do for me? And I think that is a valid question for all of us, whether it's personally or professionally. And I think that going forward, at least what I think people should be thinking about is that if I'm going to use AI to, as you were talking about, help with the mundane tasks, right? Take me out of a loop of something that a machine can do, not only do faster, but do better, right? Because that's what we, at the end of the day, that's what we're all looking for, right? And how could that free me up, whether I'm a patient, whether I'm a healthcare worker, whether I work in the industry, personally, what would that free me up to explore, right? Whether it's, creativity or, improving skill sets in other ways, right? How AI can make my life better. We all have examples in our day-to-day personal life. You mentioned it, Alexa, Siri, we're using AI, most of us are using AI constantly at home to save time, do calendar reminders, help us with recipes, right? And all we have to do is sort of take that mindset and put it into the workplace with the idea, of course, that at the end of the day, we want to use it responsibly, but we also want to use it to our advantage.
Those are good points, Carol. I would just conclude with thinking about, as I think about healthcare and sort of some future predictions, I think about both the operational side and the clinical side. So operational side, there's so much administrative waste in healthcare. I mean, it's been there forever. It's not, it's only increased if anything. So I'm super excited about the technology's ability to maybe save some costs in our healthcare ecosystem, and particularly on that administrative side. So that's the operational piece I'm looking forward to. I think we're seeing small steps there and small strides, but I'm really looking forward to that huge wave because I know it's coming and I think it's going to be very well received by the industry. The other area is the clinical. And I did have somebody on my show recently, a cardiologist from UCSD, and he is using an AI technology to look at cardiac images and help diagnose a disease called cardiac myopathy. I wasn't familiar with it. It means an enlargement of the heart muscle. And what's sad to say is it is a killer of young people because they don't even realize they have it. And so the ability to use it to identify potential cases earlier, faster, with more certainty, is, I think, those kind of technologies that can look at our images and alert physicians of a potential diagnosis, a potential risk. Super excited about that on the clinical side.
Yeah, I'll echo that. I think on the clinical side, the potentials, of course, are huge, 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 huge. I listened to a conversation the other day, and it was really about using AI technology to monitor babies in the NICU, right? And just think about how fast a response is that, that AI monitoring system can do from an alert standpoint. Then, the eyeballs of a nurse, not that the eyeballs of a nurse aren't critically important to this, but it, about speed in a very in a care setting that can, could turn one way or another very, very fast, right? And so on the clinical side, I think, AI applications, the healthcare world is the oyster as far as I'm concerned in that area.
We absolutely have so much opportunity here, uses of AI, but to just kind of bring us back to some of the cautionary areas, right? It's that privacy and security, making sure that you have compliance with regulations like HIPAA and GDPR. Also understanding how models are built, making sure that you're at least aware that bias and discrimination could be built in and accommodating for that. Workforce empowerment, making sure that people understand, Beth, to your point, how to use these tools responsibly. And then also, Carol, as we touched on, making sure that the workforce understands why some of these tools that are meant to enhance their work and their day-to-day and reduce burnout and run a more efficient businesses, allowing them to get back to the more complex parts of their job, the more thought-provoking. It's just making sure that the workforce really understands the implications and the investment strategy behind some of the AI tools. So it's very clear to me that there is so much to unpack and we have not even scratched the surface. But I did want to thank both Carol and Beth for joining me on today's show. I look forward to this topic. I know that we have some speakers lined up for the exchange that are going to be bringing some additional insights around the topic. And so very excited to see how things unfold in the future. So with that, thank you all for joining us. And thank you again, Carol, Beth, for being my guests on today's show. Also want to just remind all of our listeners, every 2 weeks, we are producing another version of The Exchange, where we're bringing healthcare execs together. And you can always check out our resources at mrocorp.com. So thanks again. Thanks for joining us.
You've been listening to the MRO Exchange, where we connect healthcare execs. For more insights and to hear other healthcare executives' exchanges, visit the show's page on mrocorp.com and be sure to explore additional resources and thought leadership articles. You can also check out the program page on healthcarenowradio.com. Finally, be sure to connect with us on LinkedIn or X at MRO Corp. Until we talk again, this is the MRO Exchange, where healthcare execs connect.